I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've helped thousands of women and their families transform their health using evidence-based integrative strategies. I'm deeply passionate about making science simple and actionable so you feel confident and empowered with your health decisions. This channel is your go-to for trusted insights, expert conversations, and practical tools that support your real life wellness. Today, I'm thrilled to be joined by Claire Luckman, an Australian naturopath and nutritionist currently based in Amsterdam. Claire combines holistic, root cause focused strategies ranging from functional testing to tailored nutrition, herbal medicine, lifestyle, and stress support to support women's health. Today, we're going to cover the extremely challenging topic of female pattern hair loss. Recent Australian statistics show that female pattern hair loss is very common and increases with age. Approximately 49% of women will be affected by hair loss at some point in their life. The numbers range from roughly 12% of women in their 20s to about 40% by the age of 50. Now, today, Claire is going to share with us her knowledge and insights on this very impactful health condition. Claire, thank you so much for joining us today. I really appreciate your time.
Such a pleasure. Nice to see you, Em.
Now, let's hit the ground running today. The topic, female pattern hair loss. What is it exactly? Let's just start with a bit of a definition to get things started.
Technically speaking, female pattern hair loss or baldness is a type of hair loss or thinning that's usually caused by hormones or genetics or both. And for women, you usually see the presentation of kind of thinning all over the head or loss of hair all over the head. Sometimes you do get more of that pattern of kind of a widening part, but a bit different to what you see with male pattern balding of the kind of receding hairline and on the scalp. But as I'm in clinic, everyone presents differently. So I certainly have seen lots of different patterns of how it presents in women.
Absolutely. And what are the differences between female pattern hair loss and other common causes of hair shedding, like telogen effluvium or stress-induced hair loss? I mean, I remember losing heaps of hair after I had Sophia. So what are all the different types of hair loss?
That's right. There's so many different types. And I think that's where obviously in clinical practice, we really want to kind of get down to the nitty gritty and work out the drivers. Certainly, yes, that big hair loss postpartum. I think most women nowadays know about that big shed. That's really more due to a big hormonal shift from an estrogen point of view, which is really high and stable throughout pregnancy and then drops really suddenly immediately post-birth, and women can experience hair loss from that. Stress-induced hair loss, we see this a lot in clinic, and that's more from that big kind of phenomenon of stress interrupting the hair growth cycle. So women will experience a sudden shed and maybe less hair growth for a couple of months after that. And another one, you've probably seen it in clinic too, Em. In the past couple of years, I've seen so much post-viral hair loss, particularly after COVID. And it's well documented now. There's about 20% of people who suffered with COVID will have hair shedding in the months after, particularly if they had a high fever that caused that inflammation on the body. That's something I've seen quite a bit of. So there's lots of different forms of hair shedding, but I think the main thing that I look at when I'm assessing it from a more kind of technically speaking female pattern hair loss point of view is that those women are presenting with kind of consistent and constant hair loss and hair shedding, whereas postpartum, you and I had a big hair shed, but then it was done and it kind of grew back and it was fine. Same with stress. Usually women will have a big shed and then hopefully that stress subsides and it goes away. So different to that kind of consistent hair loss that women feel like they present with.
Really interesting you say that, because I have patients that have come in and they're really clever. They will collect their hair and each week take a picture of it and document it. And I had one
They know
patient
how
that
much.
came with a Ziploc bag for each week. And so she knew exactly the consistency of the hair loss. So you can really get a lot of information from gathering the hair and managing to track it in that way. But
Sure.
what's the current understanding around the main drivers of female pattern hair loss? There's genetics, there's androgens, there's age, there's inflammation, metabolic health. What matters the most? I mean, I tend to see women that have the high androgen levels in hair loss, but what are the drivers involved?
Yeah. So certainly I think in that kind of classic or textbook female pattern hair loss, we are thinking about elevated androgens or male hormones, and then certainly genetics can play into it too, and maybe even age. So, different ages, you can see that elevated androgen picture. Younger women, maybe they're presenting with more like that polycystic ovarian syndrome type picture, and they're already getting hair loss in their late teens or 20s or 30s. And then that other picture of elevated androgens I'll see in that like later perimenopause, those androgens start to rise a bit. Certainly then transitioning into menopause and having that estrogen drop alongside elevated androgens can really give a lot of that hair loss for women in that age bracket. And then, of course, genetics. I think just like you say, women being savvy about collecting their hair and seeing the pattern of it. Women also will present and they know, yes, my mum had hair loss too. It started at age 45, or yes, my dad started balding when he was 45 to 50 or younger. Whether you've got a mum or a dad that presented with that genetic picture, that can influence, unfortunately, the likelihood of it for you too. And then I think inflammation and metabolic health, certainly, like you say, are big drivers too. Maybe not approached as much in the medical mainstream, but for you and I and other integrative healthcare practitioners, we're thinking about those things, especially because if there's elevated androgens, there can be that double-edged sword effect of insulin resistance or having unmanaged insulin. The more insulin there is in the body, the more it stimulates the ovaries to produce androgens. So they could have metabolic problems, which then kind of lends to that elevated androgen picture too. So it's certainly something to consider as a driver.
I think you would see the same thing. Hair loss in women is deeply psychologically disturbing for women, so stressful. And it feels like everything is wildly out of control for them, and that they just, before they know it, they're going to wake up and be bald. And I think that the psychological aspect of it needs to be acknowledged as well. And it's identity for women.
It is.
How do you support that psychological side of their hair loss?
I think certainly, like I've had clients similarly who maybe they don't show me the Ziploc bags of hair, but they'll take photos and send it to me. Certainly they're counting the strands. I've had women who will kind of count the strands every night or every time they wash and brush their hair. So you're right, it's such a big stress for them. And so we have to acknowledge that stress side of things. I think knowledge is power. And I think setting them up to understand why they're losing hair and what we can do about it from the get-go is probably my biggest priority, because that's what we all need. Right? When we have a health problem, we want to be reassured that there's a solution, that there's something we can do about it. And it's easier said than done, isn't it? Oh, don't stress about your hair loss. That doesn't really stop it for women who are experiencing it day in, day out. So certainly for me, giving them kind of a solution quickly and getting them to understand that I understand the drivers and we know what to work on. I think that's a big relief for women.
I love that angle. Then when it comes to assessment, because there's tests and assessment measures that you can do, tell us what you do. And then just cycling back to what you said, when you get test results and you can explain those to women and they can see in black and white what's going on, I think that as well can have a really positive effect psychologically.
So I will definitely use testing, and straight off the bat, often with my clients in practice, I love to really get them to do tests straight away, especially with hair loss. So I can show them that we understand the drivers and we're working really therapeutically. So certainly female pattern hair loss, we will look at the androgens straight away on hormones. So I'll do full male and female hormone profile. I want to see all their testosterone markers. DHT, which is dihydrotestosterone, is kind of the offshoot of testosterone, more kind of active or potent testosterone. That's important that it doesn't get missed on these kinds of bloods. I'll want to look at estrogen as well and their ovulation kind of hormones. And then because, as I mentioned, there is often that double-edged sword effect with insulin and blood sugar kind of problems, I want to make sure they're doing a fasting insulin and timing that correctly, making sure we look at HbA1c, which is a 3-month average of their blood sugar markers, much more relevant than just a one-off blood glucose test. So then I can assess if there's that double-edged sword pattern of androgens and insulin resistance. And then also thyroid panel. We can't talk about hair loss without talking about thyroid health. And I think making sure we do a really thorough thyroid assessment, including antibodies, to check that there's no autoimmune thyroid activity going on is really important. And there's that link, we know, we see it clinically, but even in the research between PCOS and Hashimoto's, that autoimmune thyroid condition. So I've had those poor women who are suffering from hair loss from two kind of angles. Thyroid function and androgens being elevated. So certainly thyroid panel is going to be done. And then also I'm going to be making sure we do nutrients. Iron being low is going to drive hair loss. Iodine being too low is going to drive or contribute to hair loss too. So checking those on bloods or urine is going to be really important to me.
Yeah. A patient comes to mind who had Hashimoto's, who was not just suffering hair loss, but eyebrows and eyelashes as well.
Yeah,
And
that's
so
right.
that can really profoundly affect hair from the
Mhm.
angle.
Yeah,
And
for sure.
then the impact of stress obviously
Yeah.
is so big on
Mm.
that side of things as well. Do you ever test? I mean, sometimes I think, is it worth testing, or it's probably
Mm.
so obvious, the cortisol
Mm.
levels?
And look, same as you, it's often obvious, and we can see kind of straight off the bat if a woman has a lot of stress in her life, which of course many women do, and then the hair loss itself presenting or kind of giving them more stress, adding to their stress.
Yeah.
Cortisol, I usually will test saliva cortisol if they need a bit of convincing. They're maybe not really seeing that they have got a lot of stress. And I think women are really good at that, right? We're busy, we've got a lot to do, we juggle a lot. And I think then we just think, oh, that's just how it is. Isn't this how it is
Mm.
for everyone? And so if they need a little convincing on maybe the stress support front, I will say, you know what? I'm happy to be proven wrong. Let's do a salivary cortisol test and let's see what it looks like. And then we can assess it from there.
And I think that's a great strategy. When it comes to medical treatments, like often patients will have already seen a GP because they need to make sure there's nothing kind of going on that's
For sure.
untoward. But
Mm.
once they've seen a GP, what are the medical treatments that are usually offered? What's standard practice offering women in this space?
I tend to see probably the most common options are the anti-androgen kind of options from a medical mainstream. So two medications I find prescribed the most are the minoxidil, and that can
Yes.
be either topical or sometimes I have patients who are using it orally as well. So the vasodilator medication, so it's used to kind of increase blood flow to the area and try and stimulate more hair growth and then hold on to that hair for longer. And then there's a theory it might be a little bit of an anti-androgen medication too. And then the other one that I see a lot, even in younger women, I've had kind of women in their very early 20s use another medication called spironolactone. I can never say that
Okay.
one properly, but it's an anti-androgen. It has a very strong anti-androgen effect, but it's actually a blood pressure medication. It's
Mm.
a diuretic. So it is used to really block that production of androgens or male hormones. And the other option probably presented or offered to younger women if they've got that PCOS type picture is the oral contraceptive pill or the
Mm.
pill. And that would be kind of used to fix or solve their issues with their irregular cycles, but their hair loss, etc. too. So, and look, the problem with these medications, and you would see it too, Em, in practice,
Mhm.
is as soon as those women try to come off them, the hair
Oh,
loss ramps up again immediately, really quickly, and they feel like they can't stop.
yeah.
Understandably, they're scared to come off it
Mhm.
because it really hasn't solved the problem. It's just blocked the problem for a short amount of time.
Yeah, I particularly see that with the oral contraceptive pill. We get this
Yeah.
massive shedding. And so, to be fair, they're probably not great long term options
Mm,
that are offered. And
mm,
I always am thinking, if you're not addressing those underlying drivers, then
mm.
the problem doesn't just disappear,
It
doesn't just
doesn't.
go away. From that naturopathic angle, I think we have very large toolkit to treat female pattern hair
Mm.
loss. But let's go through some like nutrient wise. What do you see being of value here from a treatment perspective?
Yeah. We have so many different options to use. And I think I've got quite a list in my head when I'm assessing a client with female pattern hair loss, but we want to narrow it down and obviously use
Yeah.
what's relevant and going to be efficient for her. Certainly, I'm thinking about the dryness then. So, if it was really androgen or male hormone driven, my first nutrient that I'll think of is zinc. Zinc is a really well known for helping to block or reduce an enzyme which is called 5-alpha reductase. And that enzyme converts testosterone into DHT or that more active kind of potent testosterone that really impacts hair health. So zinc is really well utilized. A decent dose is what I'll go for. And so that's definitely one of my biggest go-tos with the androgen side of things. If there's a double-edged sword effect, like I said before, with insulin problems,
Mm.
insulin resistance, blood sugar imbalance, then I want to work on that as well with nutrients. And my biggest go-to is probably myo-inositol. It's
Yes.
really well utilized for helping to manage insulin resistance and comparable in big studies to metformin, which is that most commonly prescribed diabetic drug. So it works fantastically. And using zinc and myo-inositol as that double-edged sword effect from a treatment
Yeah.
strategy, I find really useful. My thyroid patients, if there's that thyroid factor kind of going on as well, especially from an autoimmune perspective like Hashimoto's, then
Mm.
my biggest nutrient kind of straight off the bat is selenium. Such
Yeah.
a potent antioxidant, really good for helping to reduce that inflammation and that autoimmune type picture
Mm.
with thyroid health. And I find that sometimes paired up with iodine in the right patient, there's nuances to prescribing iodine for sure with our autoimmune thyroid patients, but those together or iodine then being brought in at the right time can make a huge difference. I'm thinking about those nutrients with my thyroid patients. And then across the board, I'm assessing iron. So if their iron is low, which we know, and so many women have low iron or iron issues, then iron with really good cofactors is going to be a big go-to as well for hair health.
I love that. And then from herbal medicine, oh my goodness, we are spoiled for choice. But I know this depends on the underlying drivers, but can you talk us through some options that you use clinically and seeing helpful?
Yeah, for sure. With herbs, again, if it's that male androgen picture that's really driving that female pattern hair loss, then I'm a big fan of using 3 herbs in particular and together to have that synergistic effect. So those 3 herbs are saw palmetto, licorice, and peony. They all are what we call anti-androgen herbs. Saw palmetto in particular has actually been researched again to support blocking that enzyme I just spoke about before with zinc. So that 5-alpha reductase, it actually blocks the enzyme activity. So we're not getting that conversion of testosterone into DHT, that kind of offshoot, which is more problematic when elevated. So those are my 3 go-tos if I'm thinking about an androgen-driven hair loss picture. If there's thyroid involvement and it's kind of that underactive thyroid or that Hashimoto's type picture, I'm thinking of our beautiful herbs like ashwagandha or withania, rhamania, rhodiola, sometimes things like bladderwrack if there's that low iodine status too. If there's a hyperthyroid picture, which can drive hair loss for women as well, then I'm thinking about those kind of anti-thyroid herbs. So calming herbs like lemon balm, weed, motherwort. And then, of course, the stress factor should be approached. And we are so lucky to have such a good toolkit of things to help with stress for women, not just saying to them, stress less and your hair will be better, but actually utilizing herbs that will help them adapt. We call them our adaptogen herbs, beautiful herbs that help the nervous system to kind of come back down into that parasympathetic stress response so that they're not kind of sitting up here in that fight and flight all the time. So ashwagandha, again, I think lots of people know about these days. Licorice, beautiful herbs for stress, our ginseng, and sometimes things like nettle leaf if there's low iron or I really want to nourish that kind of blood level as well. I'll use things like nettle leaf. So we're totally spoiled for choice. We have so many beautiful herbs.
Yeah. And what I love about what you outlined is that your choice is very driven by the underlying mechanism that's going on, which is very specific treatment, which is just so important in that naturopathic philosophy of individualized prescribing is that you need to look at the underlying drivers and then you need to prescribe for the patient sitting in front of you.
That's
So
right.
I love that we have so many things in our toolkit, but the way that you're prescribing is also really great at addressing those underlying drivers.
Yeah, for sure. We want to be specific. Otherwise, we can be generalized and it's not going to have the same effects for that woman compared to that woman.
You would see this in clinical practice in as far as patients are self-prescribing. So they're trying often female pattern hair loss, they'll come in with a bag of supplements or they'll send me
That's
pictures. It's
right.
all lined up on the
I'm
kitchen
taking
table. There's like
yeah,
15 things lined up. And I just think I
totally.
understand why you've done this. I really
Yeah,
do. But, you
yeah.
know, they're not all going to help. They're not
Specific.
tailored.
Yeah,
They're not specific. And the
that's right.
dosing is terrible. The
That's
forms are
right.
terrible. I love how specific and strategic you are in the ways that
Yeah.
you're treating.
There's lots of really lovely general nutrients for hair health, collagen, silica, biotin.
Yeah.
You can buy them till the cows come home and every chemist online, everyone's got a brand of hair support. But, that may be well and good for your best friend or your colleague and they thought their hair was fabulous on it, but it's not the same if you've got an androgen-driven hair loss picture. Silica isn't going to fix the problem. So we really need to work out the cause.
I mean, when it comes to lifestyle strategies, because naturopathic medicine is diet, lifestyle, it covers so many things. What do you recommend to support women while they're treating their female pattern hair loss?
We've got so many different tools to use, and I want to really kind of individualize even my lifestyle strategies for women. But certainly, I think even across the board, having adequate protein intake from a diet perspective is super important. We see it all the time in clinic, and women are under eating on protein, and that's full of amino acids. Hair is made of keratin, which is a protein. So if we're not getting adequate protein intake, that's going to jeopardize our hair health in the first place. And certainly it's even more specific where I have thyroid patients. I want them having more protein again than my average patient, my PCOS or high androgen, high insulin patients. Again, I want them having lots of protein. So protein and really helping them kind of understand that is probably a big strategy. Obviously, stress support, making sure they're getting adequate sleep, talking to them
Yeah.
about how they maximize sleep and help with sleep hygiene and all of those beautiful bits and pieces is going to be relevant. Exercise, again, specific to what is driving their hair loss. So if it's that elevated androgen picture and they do have that insulin resistance, then I'm really focusing on using exercise to help get that insulin resistance back, help that insulin sensitivity, and maybe get them to exercise after eating to promote that, getting them to do low intensity strength training, all of those kinds of strategies. And then I certainly will also give them things that they can do at home, which a lot of the time their hairdresser is commenting on as well. Hair massage, brushing their hair more often, using rosemary oil to massage into the
Yes.
scalp. You can use castor oil. I think even when men go to those hair clinics, part of the treatment that they pay so much for is the scalp massage. Every time they go,
Yes.
it brings blood flow to the scalp. I mean, it's logical, isn't it? So
Yeah.
I always say to women, brush your hair even though it feels scary, use oils and massage it into your head. We want to stimulate blood flow up to the scalp. So we could be doing that daily at home too.
Fantastic. We need to be realistic and be very
Yes.
clear with patients around their expectations of
Mm.
naturopathic treatment. What do you counsel women in relation to timeframes? Because, of course,
Mm.
everybody wants a quick fix, especially when it
Yes.
comes to things like this. But
Mm.
what do you recommend in that?
I usually say to women straight off the bat, again, I like to give them a time frame so that they're not disappointed if it's not kind of fixed overnight, especially if they have used medications in the past and they can act quite quickly, which seems like a good thing. But as we said, it doesn't always have the longevity. I usually say to women, look, you've got to give it 3 months to see a really big shift,
Yeah.
especially if there's that hormone kind of driver. It takes a bit of time for us to change those elevated androgens, work on that insulin, work on thyroid antibodies if that's
Mm.
part of the picture. But, I've had so many women who, once they begin the herbs and the nutrients and we're really working tailored to their need, 6 weeks in, they'll email me being like, Claire, it's so much better when I wash and brush my hair. There's so much
Yeah.
less dropping. I can see little baby fuzzy regrowth and things like that. So I set them up maybe with a time frame that's a little longer than they might see a difference in the shedding, just so that they're happily surprised rather than feeling disappointed that it's taking longer than usual. But yeah, I agree. There's got to be a realistic time frame. These things take a little bit of time.
Yeah, I love that. I love how you kind of under promise and over deliver.
That's
I
right.
love that.
Set them up
It's
to be
such-
happily surprised. It's a nice thing
yeah.
to do.
Yeah, I think that's beautiful. And then, are there any myths that you want to bust for us in relation to female pattern hair loss, or any last thoughts or things that we haven't covered today?
I mean, I think, as you already mentioned, there's so many different supplements that women have already self-prescribed. We see that all the time with things that you can buy
No.
online. Marketing does a fantastic job,
Yes.
social media and things these days. So women certainly have already got half a toolkit at home, but it's not always relevant. Like we said, getting your female pattern hair loss assessed by a practitioner who can work out
Yeah.
the driver, it really is going to make the difference to you having a really positive outcome versus it kind of just getting slightly better or not improving much at all, despite you taking expensive supplements you've bought. And then I think too, just making sure that stress perspective is really looked at too. Stress causes inflammation and it can change the antioxidant level in the body. So it's really something that I think is easier said than done. But, like we've discussed, we've got tools that can really help that stress response.
I think that's one of the reasons that treatment fails in relation to when people try things at home, is the fact that
Yeah.
they aren't also covering that stress and cortisol and hence inflammation component. That they're purely treating hair loss as just a one-dimensional thing. But when
Yeah,
we
that's
do
right.
that holistic treatment where we're supporting the stress levels, we're moving them to a more anti-inflammatory diet, we're providing the nutrients to help nourish the hair and the hair follicle itself, I think that all comes together really nicely. But when you
It does.
miss either working out the drivers or you miss that psychological component as well, it really is just a one-dimensional treatment.
That's right. It's not really going to target it specifically or give them the long-term effects that they're after either. We want this to be a kind of longevity solution for them, especially with that textbook female pattern hair loss. It doesn't kind of just happen and then go away. They tend to be kind of suffering with it for a while. So absolutely, the stress component is huge.
Thank you so much for joining us today, Claire. We will have you
Pleasure.
back. We've got other conversations we have yet to have, but you will be back
Absolutely.
on the channel again. But thank you so much for sharing all your expertise today on female pattern hair loss. Much appreciated.
Such a pleasure. Thanks for having me, Anne.
Thanks for being with me today. Don't forget to like the video and hit that subscribe button. Check out the links in the show notes for more health empowering information. And please feel free to ask any questions in the comments below.